This has become a relatively normal scene in Havana. Cuban doctors going door to door, screening for any symptoms of COVID-19. It's a strategy that has apparently paid off. Monday marked 9 days without any new coronavirus deaths in the country.
I believe that these results are based on our care protocols. They are based on the facts. First, early detection is important because when you detect a person with several days of evolution of the disease, with several days of symptoms, the possibilities are decreased. And early detection is achieved through screening, through case finding.
Many Latin American countries are struggling to curb coronavirus contagion, but compared to the rest of the region, Cuba is miles ahead when it comes to containment.
We see once again that despite having the difficulties we're going through, our country has managed to control the epidemic and has achieved figures that are reasonable relative to the rest of the continent. And despite not being developed countries, we've achieved good control of the pandemic.
The streets of the Cuban capital are once again filling up, albeit with a great amount of care, as many who venture outside do so wearing face masks, which have become mandatory by the government. Refusing to wear one could lead to a fine or arrest. Cuba's success in mitigating contagion is being seen as a ray of hope for the region, though international health experts warn that in other parts of Latin America, the hardest days are still to come.
So there's a lot of work that needs to be done, and we need everyone to remain focused on achieving the goal at hand, which is stopping this pandemic, which is suppressing transmission and saving lives, and there's a lot more work to do. So let's celebrate the successes that we do have, but let's remain focused on the remaining work that needs to be done, because unfortunately this is far from over.
With no new reported deaths in over a week, authorities have declared the outbreak in Cuba under control. Manuel Rapalo, Al Jazeera.